Welcome to What's Your MO? On today's solo podcast, I'm going to be getting into stomach massages to get pregnant. Is this legit? Is there some merit or some truth to this? For anybody that doesn't know, I am suffering or I have some issues with infertility, not being able to get pregnant, and that's what we're going to be getting into today. So I'm going to be experimenting with a lot of this stuff. So you can experiment as well or not. Of course, this is not medical advice. Mani and I usually do a weekly podcast together, ranging from conspiracy theories, health and wellness podcast, movie reviews, and much, much more. All right, so let's get into it. So why am I talking about stomach massages to get pregnant? Is there merit to this? Is there any truth? Does it seem too good to be true? I don't know, but I'd like to expand my horizons and not just, I guess, listen to a conventional Western medicine doctor. So why am I talking about this today? Well, I have blocked tubes, and I'm going to get into different types of blocked tubes and different things that you can be doing, or why somebody would want to, in my situation or their situation, whatever the case may be, think about an abdominal massage, a simple abdominal massage at that. Now, I have blocked tubes. And blocked tubes is also known as hydrosalpinx, which is fluid accumulation in the fallopian tubes. There are two different types of blockages that can happen. There's a proximal blockage and a distal blockage. Now, hydrosalpinx affects about 1 in 4 women with infertility. So there's a lot of women suffering from infertility, various different reasons. And if there's a natural remedy out there, I'm for it. So right here on the left is a natural view of the fallopian tubes. Now this down here is your cervix right here, your vaginal canal, and then all the way up to your uterus area leading into your fallopian tubes, which is basically the area where the blastocyst or the ovaries meet the fallopian tubes, the eggs gets released to the fallopian tubes, forms into a nice blastocyst, and then implants itself into the uterus, giving you a baby if everything goes well. Now, on the right-hand side is a blocked tube. This is considered a unilateral blockage, basically. So this tube on the left is working, but your right tube isn't. It's fluid-filled. Over on the right over here, this is bilateral, meaning both of your tubes are blocked. And basically there's a fluid accumulation in both of your tubes. So I have bilateral hydrosalpinx, and the two types of blockages that we're going to be talking about are what I had mentioned already or previously is the two different types, which is a proximal blockage, which is near the uterus. So right here at the opening could be a blockage. There could be debris in this area, blocking, scarring, many different things, I don't know. Or a distal, which is the further away blockage, which is right here, this distal further away area that's closer to your ovaries. Now, the type of blockage that I have is the distal version of this. Now, the reason these two are important is because the doctor may recommend different things, different remedies, treatments in order for you to conceive. Now, the way that you can find out whether you have a blockage or not is through an HSG, which is a hysterosalpingogram, where they put fluid up there to see if there's fluid that can basically go through your fallopian tubes, well, in through your uterus, out through your fallopian tubes. Of course, there's more to it, but if you had a proximal blockage, most of the time, fluid can kind of push any debris out and basically cause them to be patent, which is clear. Or they can also do another procedure for you called an FTR. An FTR is basically stands for a fallopian tube recanalization. So they do basically the same procedure they take in, or a similar procedure to the HSG. And the HSG is but this time they take a guide wire up and they basically clear out debris from your proximal area of your fallopian tubes to become clear. Now, the problem is if you have the distal blockage, if you have that further away blockage that's closer to your ovaries, that FTR, fallopian tube recanalization, is not something that they're going to do on you. I mean, I thought they were going to do it because after my HSG, the doctor basically said, hey, you probably can do an FTR procedure. And I thought, oh, okay, perfect. And then I spoke to the surgeon who was going to perform it, and he said I had marked proximal distal mouthful over here, blocked tubes, hydrosalpinx. And he says marked just means like severe hydrosalpinx. It kind of looks like a big old sausage over here, and it's quite the sight. And he says I'm not a good candidate for it. It's too close to different structures, organs, and it's too high risk for me to do it. And I thought, oh crap. Okay, so I can't do the FTR. What can I do? And the other option for people who have this further away blockage is basically IVF. And you go for your consult, you get referred for a reproductive endocrinologist. You could even get that referral for the reproductive endocrinologist to get the HSG initially. But let's say for this, you go to your doctor for IVF and they talk to you about it. And if you have this distal blockage, the only problem with this is that you have to give something up. And it's a bit scary thinking about it, because here's how it works. Basically, your tubes are not functioning correctly, right? My tubes are not functioning correctly to do the basic conception stuff that's needed to implant in my uterus to give me my baby. So when I spoke to the person I was reproductive endocrinologist, she says that since my fallopian tubes are filled with fluids, it's not just any types of fluids. It can be fetotoxic, toxic to a baby type of fluid. So I thought initially, oh, okay, I'm going to go for IVF. They're going to, do this egg retrieval thing. They're going to take eggs from my ovaries through a certain procedure. They're going to cultivate that outside of my uterus outside of my fallopian tubes, because my tubes don't work. They're going to form that into the nice blastocyst thingy that's needed, that turns into your baby, and implant that into your uterus to start making your baby. So basically bypassing the tubes that are not functional currently. But since the fluids inside there could be fetotoxic, they want to take these tubes out. And rightfully so. You don't want tubes to be messing up your IVF. So if that's something that, you feel is needed, sure, why not go do that? And I thought, okay, this is something that I could potentially explore, which is why I've gone down that avenue and gotten this information. But it doesn't mean that's the first thing that I'm going to do. I'm going to search the internet and see if there's any alternative holistic things that I can do. So that's what I'm doing now, and that's what I'm talking about. Now, is there another way? As I mentioned previously, I have done this previous podcast about DMSO and CDS and about tubal flushing, hydrotubation. You could check out those 2 solo podcasts that I did previously. It's called DMSO and pregnancy. But what if I have, and many women actually have, adhesions? So adhesions are basically glue-like connective tissues that band together and glue your insides to all the wrong areas, causing dysfunction. So we saw up here a normal, cervix, vaginal canal, uterus, fallopian tubes right here. And this is the abnormal version of it. But what is the cause? There can be many causes such as endometriosis, infection, PID, previous abdominal surgeries actually cause adhesions, which I think is kind of funny because they want to do a laparoscopic to take out your tubes that could potentially cause adhesions in the future. But adhesions, right? So these are scar tissues that band together and just take all of your parts and connect them to areas that don't need to be connected, causing they could cause a tightening pain, severe period pains, pelvic pain. And it could be a big reason that there's a lot of women with infertility issues. Of course, this is not the cause. This is one of the symptoms, a byproduct, a symptom of a larger issue. So if you've had some sort of disease process or whatever the case may be, your body produces some sort of adhesion in order to compensate. But it causes a lot of problems in the future. Now, in the next picture, I do have a Tony Robbins quote, and the only reason I have this up here is because I follow some of Tony Robbins' work. I listen to and read his books, and this is a problem that many women are facing, but I'm going to read this quote. The only problem we really have is we think we're not supposed to have problems. Problems call us to a higher level. face and solve them now. So we all have problems, and we can either face the problem or not face them. And I choose to face my problems, and I hope many of you choose to face those problems as well, because, IVF is probably making a ton of healthy, beautiful babies, but there might be other ways, and cheaper ways at that. Maybe things that you can do at home, such as these abdominal massages. I mean, it'd be ridiculous if there's an abdominal massage that you could do, and you could probably do it with your own hands, with your husband's hands, your partner's hands, and get pregnant. I just think, whoa, okay. So the reason I mentioned also, the other reason I also mentioned Tony Robbins is because he had a brain tumor, a pituitary brain tumor, that a doctor, and he basically had a back and forth with a doctor who wanted to take it out. He wanted to perform surgery. So I thought that was funny because, he has a quote here on, what people want to do dependent on, their status in the world. So a conventional doctor or surgeons, the fix for them is surgery. For the fix for me in IVF is take out your tubes and only be able to get pregnant through IVF. $17,000, $30,000, a ton of money every single time I want to get pregnant. But as Tony Robbins says, and in the end it goes, the baker wants to bake, the surgeon wants to cut, I want to drug you. You should do what you want. Now, you should do what you want. I think this is important, and this is something that medical doctors don't say out loud, but the truth is we can do what we want. And this is not medical advice, but I am going to do what I want. So getting into the abdominal massages, there's a company called Clear Passage that has been around for years and years, and they have this technique, abdominal technique, stomach massage, which is called the Warren technique. So basically it provides claims that it helps lesions. It helps with adhesions that has also helped women get pregnant after these abdominal massages. The only thing that I think is a bit costly is that the treatment costs around $6,500, I think $6,500 to $6,700 for the treatment. You can go for about 5 days, and the only reason I know this little portion here is because I consulted with somebody on the phone about it, or the Clear Passage people on the phone. You have to do like a history and physical and history form that you submit to them. They either accept you into the program or not. And, the reason they may not accept you is probably because of some comorbidity, some disease process that you have that may not do well with their abdominal massage. But basically they do 2 hours in the morning of abdominal massage. And then in the evening, like after the massage, you may go for a walk, and then 2 hours. And then afterwards they'll do like 2 hours in the evening, or they could spread it out. It depends. But it seems as though they want you to do the 5-day approach. And what is the Clear Passage approach? So the Clear Passage approach apparently is like this unique hands-on therapy developed over 25 years of study and clinical research by Belinda Warren, which is where the name of the technique was made, and her husband Larry Warren. Basically, Belinda suffered cervical cancer and potentially formed a bunch of adhesions after she got extensive radiation and had a bunch of abdominal issues after that, and did this technique on herself, and it worked basically for adhesions, her pain, and she ended up helping other people because she's a physical therapist, so she was doing this for herself, did this for other people, and this woman, for example, couldn't get pregnant for about 7 years, had hydrosalpinx blocked tubes, and went to Belinda for therapy, not to get pregnant. At the time, Belinda didn't know that this was helping with that. She did it for her own reasons. And the woman ended up pregnant, even though she had been told by conventional doctors that she couldn't get pregnant because of her blocked tubes. So she told Belinda, hey, I think this is because of the abdominal massage that you did. So that's where Clear Passage basically got their big name in focusing on this. So their focus is to deform the bonds that detach collagenous cross links, the building blocks of adhesions. Basically, like adhesions, they're not so cookie cutter. They actually are really, really strong, and they restrict certain areas, and you have to do these techniques to help break them or even loosen them up. So this is a snippet of a piece of information I wanted to talk about the effects of the Warren technique in adhesions. So the therapy used various site-specific pressures across the restrictive bands of adhered tissue and structures, working progressively deeper from the most superficial tissues, which is like not as deep, to restore mobility of structure. The Warren technique operates by peeling apart adhesions. The nurse should apply site-specific pressure over the adhered parts in the abdominal region for over the course of 20 hours, as I had mentioned above, in 5 days. It improves the movement and elastic nature of the targeted reproductive organs and various support structures that hold them in place. The soft tissue pressure application decreases the amount of adhesions and microadhesions in the uterus and uterine wall. Mobilization of the soft tissue may break down collagenous cross-links and adhesions that cause pain, dysfunction, and dyspareunia, which I believe that's pain on urination, I forget, and inhibited or absence of orgasms. This reduction in adhesions makes it easier for embryos to implant by improving the surface of the uterus. It reduces spasms in the uterus and cervical stenosis. So I thought, okay, I'm going to try this. And, I called them up and I had a consult on the phone. I haven't actually scheduled a date to do it. It seems as though they have a lot of people in this area that want to do it. I think they have a place in Gainesville. I believe they also have one in New York and a couple of other areas. But I thought, okay, while I wait to decide, because they don't even have any time this month or the next month to do it on me, I could look online and see if there's anything I could do by myself. So how do they perform the Warren technique? And can you try some of these yourself with your partner or by yourself? You go on Clear Passage's website, you can go on Clear Passage, their YouTube channel. They do provide a lot of education, but they don't get into the nitty-gritty specifics on how you may do this yourself, which is something, and if I'm wrong about that and anybody wants to correct me and give me some, provide some comments and some links as to them showing you their techniques, I'm more than open to seeing that. But I hadn't seen them yet. And I think it's a bit of a disservice because there may be people who either don't have the money, don't believe that this is true, which is also another, matrix type of propaganda, right? IVF is the only way kind of thing that we've been fed, or they're risking not reaching as many people because a lot of their testimonies online are just pure testimonies from their website, and I like to see it from different sources, But anyway, getting back to it, manual treatment. How do they do this, right? So they focus on the adhered areas, so the areas that may be adhered. The therapist will engage the uterine fundus, and they have a picture down here as to an example on how they do this. So they engage the uterine fundus and side walls and tractions them to the left to assist and improve the mobility of the soft tissues. The therapist may release the tension of the traction either suddenly, so quick, or gradually, slowly over time, depending on the desired effect to decrease spasms and adhesions between the uterus and the bladder. This was evidenced by increased mobility at the precise sites of visceral and myofascial restrictions after each therapy session. The changes were further demonstrated by improving alignment, biomechanics, and increased range of motion of osseous and soft tissue structures, e.g. improved pelvic floor and many other things. And this is on page 26 of this link that I'll be providing in the description section as well, that you guys can check out if you need. And these are just some tools that I'm also using on my own that I've seen. The Clear Passage has some Zooms that they do and put up on their YouTube channel, and they talked about, hey, you can get this yoga ball and do some supine, which is on your back stretching techniques for your abdominal walls. So I've been doing that. I've also been using the smaller version of these bigger balls here for more of a focused area on my lower abdomen, where you kind of you let it sit in your suprapubic pelvic area and put it on the floor, lay on the floor, and do that kind of stuff. And then this is a picture from Clear Passage Physical Therapy Friends, one of their YouTube groups or a group associated. And this is, somebody's name here. I'll probably take that out because I don't want to dox anybody. But this is a tool that she was recommended to use at home, it seems, because Clear Passage also says they'll teach after the treatment, or even during the treatment, they're going to be teaching you how to do these manual techniques on your own at home. So this is possible to do at home alone as well. So you can get stuff like this on Amazon, tools like this. There's a ton of them there. I'd say experiment. They're what, $10 and not, this is, obviously not a medical advice or anything, but that's what I'm going to do. And, it may not hurt. So she just says, just curious if I'm using this wrong because I can't remember what they told me. Do you press in hard or gentle? Because I was pressing deep and hard, but it didn't hurt and I ended up bruising my stomach. So it seems like you have to be pretty careful. You don't want to just go straight in super deep or anything like that. And I also have two videos that I want to share that I think are important to talk about. So this is, let's see if I could get a better view of this. Yeah, okay. So this is Farm TV's YouTube channel, and the title of this is called Abdominal Self Myofascial Release. And I took some stuff from this as well. He uses a really hard, I think like a hard sand bag type of ball. I use one of the softer, smaller ones as well, but I plan on getting one of these as well because why not? And we're just going to listen to his video. It's about 1 minute and 34 seconds. I'll speed it up as well so that doesn't take too long.
It's abdominal myofascial work. I'm using a sand-filled medicine ball. You could also use like the little kids balls that you get at Walmart for $1 very easily. What we're going to do is we're going to use this ball in a couple different spots. We're going to start low in your abdomen and do about 3 breaths in each spot, working 3 spots on each side. So we'll go through 9 different positions, 3 breaths each. Do the math, we got 27 breaths total. Each time we breathe, as we inhale, we're trying to push the ball out away from our body through our abdomen. As we exhale, we're letting that ball push back into us. Fully exhale, let that ball really push in. We shouldn't have any pain here. There is some discomfort, but no pain. This is what it looks like. So you kind of get into a one-leg frog position. Head's going to relax on hands. With the breath, you'll see my body rise. Full exhale. You're going to let that ball sink in your abdomen. Make sure we're running out of air. Again, breathe in. Full exhale. And we would continue around the abdomen to finish our abdominal.
So that was just one video. There are many different videos on YouTube as well. There's even adhesion specialists who specialize in all this stuff. So there's resources out there that you can listen to, you can watch, and that I think are pretty important and beneficial. So this is the other video that I had mentioned. There's this guy online. His name is Eric Dalton, and this video is called Deep Tissue Massage for Scars, and I thought this video was also important, so we're just going to play it. It's about 2.5 minutes. We'll play it at higher speed.
Really good presentations on scar tissue. And it turns out that a lot of the techniques that I've been using for years and years are exactly the ones that seem to be most effective with what the research is saying. I don't like to come on the scars. I don't like to do any of this stuff, any of the scar. I don't like to touch the scar at first. I come on the lateral edge first, get the hook fingers, come under, try to get the tissue under. Diane Lee did a great presentation on diastasis, tearing of the linea alba in postpartum women. And you have to go under and check and make sure that you can try to get some healing in the underneath scar tissue. So I come under and get anything that's fibrotic under that scar. This is representing maybe an appendicitis scar. And once I do that, then I come above. I come above the scar, not on it yet. And I come above and I try to get under. Try to get under slowly. I just keep going under until I feel something that's resisting me, and I just follow that. Then I like to come from this direction and get under and push it up with either fingers. Sometimes if it's a small intestine problem, I'm going to use my whole palm. I'm going to come in, get as low as I can to the pubic bone and start pushing all of this tissue up out of the bottom of the pelvic floor. All right, I'm not going to go to the other side, but I would obviously do the same thing. So now I've started by getting under this thing and getting rid of some of this matrix that's scarred up like that, right? So you get in under, and check and see if you can make sure that everything is moving. On her, of course, she's got real elastic skin, and it's pretty easy to do that. On most people, it is not, people who are scarred. So then I want to put my hand directly on the scar and see which direction it does not want to go. I take it to the right, and I feel for restriction. If I feel for restriction, I hold it there and let it unwind. And then I go to if I don't feel anything, I go counterclockwise till I get to a restriction. If I feel a restriction, I hold there and I let it unwind. And you'll get some really amazing unwinding of the scar and some amazing releases in some of the organs that have attached down. Those little tornado-looking things come down, the strands could come down and attach to some of the organs and keep them from moving.
All right, so I thought that was a pretty good video. Of course, some of the stuff he spoke about was specific to, what's that called? Like postpartum, like women who've already had babies. But this applies to all different scar tissues. Of course, the scar tissues that you're going to want to get to are the ones on the suprapubic, the lower area, and that uterine fundus area right up there as well. All right, well, I think we've covered everything. And of course, I'll do a follow-up video to this. If you liked this content today and you want to hear more, I'd love for you guys to subscribe, like, comment. Thank you for joining me on my podcast, on my solo podcast today. Take care, guys. See you next time.